Hello, hello, hello. Welcome once again to a special edition of EOB Salon Talk. Tonight's EOB Salon Talk is actually sponsored by NutriBurst. NutriBurst has 72 minerals and 10 vitamins. It's like salads in a pouch. So thank you, NutriBurst, for the sponsorship. Tonight's guest is a very special guest. Um, she is Miss Nicole Gordon. Excuse me, let me fix that. She don't like this. Dr. Nicole Gordon. Can you please introduce yourself to our guest, please?
Everyone. My name is Nicole Gordon. I'm a clinician at the Westchester County Department of Health, and I'm very happy um, to be here. Thank you for having me. And I'm hopeful to provide some insightful information in the big, I guess, elephant in the room: COVID-19
Yeah.
vaccines.
So tonight's interview is pretty much going to be about everything about COVID, all the questions people have asked in the salon. This was a big conversation we were having this week in the salon, and the conversation was pretty much everything COVID. It's about the vaccination. It's about why we people get it. So we are going to dive in. We're going to try our best to address as much of the concerns and issues and just questions that I've been asked in the salon. I'm sure we may miss some, but we're just dealing with what my clients been asking, and even some of my stylists. First, can you explain to us what's the COVID vaccine, the COVID-19? What exactly is it?
So COVID has been around for a long time, but COVID is a virus. And this COVID 19 is like a sub virus of the entire COVID. So that's pretty much what it is. It's like a flu, different, like a flu virus. So every year there's a different strain. So it's almost like a different strain of COVID per se.
Okay. And this one, unfortunately, it affects our, well, does it only affect the respiratory?
No, it doesn't. So it can affect multi-organ system throughout the body. So it's not only respiratory. And this is a working progress,
Got it.
which involves research. So initially it was deemed to be more of a respiratory illness, or it affected the respiratory system. But as more research came along and how people were responding or their symptoms, it not only affected the respiratory system.
Okay. So I do have a lot of clients, a lot of family, a lot of friends that were affected by COVID-19. And, we did lose a couple of people. And, to those family, I really want to say, may God comfort you and, and keep you, because I know it's hard in any genre, in any time to you lose a family member. It's really hard. And, to lose it to something that none of us understand, it's even harder. So now we are fighting the COVID-19, and now we have these vaccinations, and we're hearing a lot about these vaccinations. My clients are confused. They are confused. They're just confused. Um, we don't know which vaccine to take was one of the things. So there are a bunch of questions that I'm gonna dive in, and if you have information that you could share, just go ahead and share. I am willing to sit back and listen. How new? Because one of the big questions and one of the big issue we're having is that they're saying, I am not taking the vaccine because it's brand new. And we had this. Production was having this conversation, and in their mind, it's something that was rushed. So I was saying that it wasn't. So can you shed a little light on that for
Yes,
me?
because
Yes,
I made sure to make a note of that because I want to be very specific
Got
about
it.
this vaccine. So this vaccine, I'm going to say this, the I would say the creation of this vaccine is not new. Okay? And first of all, the World Health Organization, CDC, would not put out any vaccines or medication that will harm the population whatsoever. The three most common vaccines which we have in this country, Pfizer, Moderna, and J&J, are very effective. I know there are a lot of misconceptions. You hear a lot of things, especially with the J&J, which is a single dose vaccine,
Right.
that, there were some rare blood clots that were formed, which, that already added to the hesitancy of people receiving this vaccine. They're like, a vaccine usually goes through years and years of trials, and all of a sudden now we have this vaccine that, boom, it's out, and they're forcing on us to take. These 3 vaccines have been very effective. I've seen it myself, having tested and have vaccinated thousands of people. The benefits outweigh the risks.
Okay. So the benefit does outweigh the risk. So on Friday, I think it was, a conversation we were having in the salon was about a specific person that took it and they still got sick and stuff like that. And one of my clients actually mentioned Jesse Jackson, and that he and his wife were vaccinated and got sick. Why should I take it? Because they got a vaccination. So can you elaborate a little bit on why would a person get sick if they took the vaccination?
Okay. So just a couple of things, and I'm going to also give example of some incidents that have happened. So we've had people who have gotten the vaccine, both first and second dose, and gotten sick right after. Do we know if it's actually, were they incubating the virus prior to getting the vaccine? We don't know, which could happen because there's that incubation period, and that incubation period can be from 2 to 14 days, and you could be asymptomatic but still positive. So really not sure what happened with that. The vaccine also doesn't prevent you from getting coronavirus. It lowers the incidence of severity of the illness and hospitalization. Now, rarely people do get hospitalized with very severe symptoms.
Right.
Oftentimes when they do, there are underlying factors or underlying medical issues that these people might have. The power of social media is like the blessing and the curse. It's there because it provides a lot of information, but people tend to just ingest so much of the negativity and not look for the positive stuff. There are a lot of negative stuff that we can see on COVID, but not really that many positives.
Right. That is true. Because like I just did a vaccination site, and some of the people that came, they had questions. What I was happy about was they spent time, the nurses that were here took about 5 minutes, spent time, answer all the questions. And, for me, vaccination is your choice. I know it's mandated now. I'm not saying you have to or not. I'm just here to give information and to get information. What I would love to do is to get the positive information out there to our people, because I feel like another thing they say was, we were killed off back in the days with the Tuskegee Airmen, and I said, no, they just didn't get vaccinated. And that's really the fact. The reality is that they were infected with a disease and they weren't vaccinated. That's why they died. They didn't die because they got vaccinated. They died because they weren't vaccinated.
And we can add something onto that. They weren't informed either that they were positive.
Exactly.
So, but this is what I will say to people who look like me, who work and live and breathe in this environment, that we have to do our homework. Mm-hmm. There's a lot of misinformation out there, but we do have to take the responsibility to educate ourselves as what will benefit you in the long run. I'm not the type of person either that I will sit with my patient and tell them that you have to do this. I always like an informed consumer or an informed patient.
Right.
I always want them to come to me with questions. I always make myself available. I don't know every answer. I try to get the information for them, whether it's a colleague or a friend or what have you, or I research it on my own and provide that information to my patient. But I want you to be able to educate yourself and make that educated decision for you. Like, this is what's best for me, and not just go by what the masses say, and you don't have that information, to make that decision.
That was good. Another question that I was asked. So even with the vaccination, how do I even determine what vaccination is good for me? Which one do I take? Is there a criteria on what vaccination is good? So these are the questions that were asked. of me, last week in the salon, like, what vaccination should I take? How do I know which one is the best vaccination? What's the difference between the vaccinations? So can you elaborate a little bit on
I absolutely can. So all 3 vaccines are effective, and it's very difficult to say, well, you should choose Moderna over Pfizer over J&J. All 3 are effective. They're a little different, so I'll explain it. So both Moderna and Pfizer are mRNAs, and J&J is usually made the traditional way a vaccine is made.
So wait, so mRNH, right?
NA. So it's a little bit, I think that's probably another conversation to have, because I'm going to use words that maybe that quite, so it's not a live vaccine pretty much. So mRNA is not a live vaccine. So whatever the solution that is injected into your body, it's pretty much what a vaccine is. So you're introducing something foreign to your body. So we're talking about vaccines in general. You're introducing something foreign to your body where you can develop antibodies. So whatever that virus or disease or what have you come and attack your body can actually recognize it exactly and fight it off. So that's the work the vaccine is supposed to do. Okay? Hence why people tend to respond, or they get icky after getting this vaccine, because their immune system is in overdrive. So with Pfizer vaccine, there are 2 doses, 21 days apart. Okay? So Pfizer has last week it became FDA approved. Before you can actually get it from 12 and above, and it's been pretty effective. You get the common signs and symptoms from a Pfizer vaccine, maybe soreness at the side of the arm. You might get a little redness. You might feel fatigued. Might feel like you have a mild case of the flu, mild headache. You might have a little nausea, a little vomiting, a little GI discomfort. If you do have any severe allergic reaction, meaning if you start breaking out in hives, rashes, very severe pounding headaches, very high grade fever, shortness of breath, chest pains, you want to get yourself evaluated. And that's with any vaccines or medication.
Got it.
With Moderna is a 2-dose vaccine also, just like Pfizer, but it's 28 days apart. So that's the difference between both. So Moderna is 28 days and Pfizer is 21 days.
Okay.
Moderna is currently approved for 18 and above.
Okay.
So it's not approved for below 18, for under the age of 18. For J&J, it's a single-dose vaccine, and that vaccine is also approved for 18 years and older.
Is that a live vaccine?
No, it's not. None of them are live vaccines.
Okay.
None of them are live vaccines.
Okay.
What we do at the health department is we do have the J&J available. We do have all 3 available. But more for a single-dose vaccine, we try to accommodate people, especially people who are homebound.
Okay.
So people who are unable to come to the clinic or come to a site multiple times. They might have transportation issues. They might be elderly. They might be incapacitated in any way. So we, when it comes to, if that type of clientele that we get, we'll give them, the choice of all 3, but we might kind of sway them towards a J&J so they don't have to come back. Yeah.
That's excellent, actually. Great information, and thank you. So I know we mentioned the time frame between vaccines, and another question that was posed to us is there a danger in them having one too soon or one too late? For example, I know one is 21 days, but what if I wait 28 days? Or what if I come back too early? Is there an effect on?
So in the beginning, CDC issued guidance that you didn't want to vaccinate too early or too late.
Okay.
Then as research got a little bit more involved, then there was a little bit of a window. So it could be a 4-day before or a 4-day after. Now that window has become, the gap has become wider. Okay. So you can get it a little bit too sooner or a little later. And the reason I'm saying that is it's better that you have the vaccine, both doses, than not have it at all.
So if I get 1 dose and I want to say, you know what, I just want to get this 1 dose, even though I was supposed to get 2, how effective is that?
So it wouldn't be as effective as if you'd get both doses.
Okay, because I have a client and she said, well, I had 1 dose and I don't know if I'm going to take the other dose, because people are saying So my question to you is it gonna be, so if she waited too long, say a month over the time she's supposed to get it, would she have to be revaccinated?
No,
No.
she
Okay.
wouldn't have to be revaccinated. She will just come in and get her second. That will be considered the second dose.
Okay, so
Yeah.
that's still okay.
Yes.
So that's good. That's good.
2 months,
To
it will still be considered a second dose. 5 months, it will still be considered a second dose. I had somebody that is out 7 months and it's still considered their second dose.
know. Okay. Oh, but it may not be as effective
Well, we don't know because we're
Oh.
still doing, we're still conducting research.
as we go.
Exactly.
So another thing that was asked of me earlier was, like, the question was like, they were saying, why am I supposed to take the vaccine? They don't even know what's happening in the vaccine. So in your professional opinion, why should we be getting this vaccine?
Okay. So, in my personal opinion, I have been doing this since March 3rd of last year. So that includes testing, which I can say I've been into multiple facilities in the Westchester County area. So hospitals, nursing homes, group homes, shelters, any type of facility, congregant facilities that you can think of. And it hasn't been good. So when you look at that and you look at people dying and there is some sort of assistance or help or solution. I'm not going to say 100% solution because we're still...
Nothing is 100% correct.
When you look at the research of the benefits of the vaccine versus the risk, I would rather take my chances of doing that versus being on a vent.
Got it.
At the state of some parts of the country, which New York has been in also, your chances of getting on a vent was pretty slim. And if you have experience with working in a hospital, not every unit has a vent, not every unit is capable of carrying a vent, not every nurse or doctor is capable of working a vent, and the amount of beds or the capacity in a hospital, and it's pretty much, you're going by the acuity.
Wow.
So that's how you stage people in a hospital, is based on an acuity. So you might go in for something minor like gallstone. You have a gallstone that needs to be removed, which is, it's invasive, but not that invasive, versus somebody on a vent. That person with a gallstone that could have been removed will have to be sent home, and that could end up in that person
Got it.
dying.
Yeah.
So I think also when you look at it, I'm not just doing it for myself also, I'm doing it for everyone else that's around me. I work in an environment where I'm constantly around this stuff every day. And even before this, we had measles, we had all kinds of different things. And we always want to protect each other. And that was my major concern.
So for me, I do also work in an environment that, so that's why we have NutriBurst and my CMOS. I take those every single day to help build my immune system. And with my NutriBurst, I remember I had COVID, by the way. I had COVID. I got COVID through a client, and unfortunately, I was exposed. I was the only one in the salon that actually got it, because I was the only person that actually worked on the client. And I had a mask on, but she took her mask off and had a cup of water, and she knew she had it, whatever the case was. But thank be to the Lord, I wasn't that sick. I felt like I had an allergy attack, and something said, nobody has allergy right now. Let me go, my allergies were normally weird time of year anyway. But I still went and got tested. I called my doctor, and I, found out I had. And I will tell you, I still say my NutriBurst saved me. I know, because I still took my NutriBurst and my CMOS, and I took those. I double and triple up on those just to help me out, because I didn't want to be breathing. I've seen people that have been through that, and I was so scared. I held it in real well, but I was afraid. So what I'll say, is it a reality that if you build your immune system up, it will help fight with the fight of it also? taking a vaccination and building my immune system up?
So yes and no. So
Okay.
we have to remember this is a virus, and a
Yeah.
virus, you can only treat a virus. You can't cure a virus.
So once you get it, you could treat it.
Exactly, and everyone responds differently based on our immune system. So we're thinking about colds and flus and all these different things that we come into, just all around us on a daily basis. Most importantly, we have to consider is washing our hands.
I need you to say that again.
Wash your hands.
And that includes soap and water.
Yes.
Yes, ma'am. Thank you.
Yes. It is so important. And, be careful with
And showering when you come inside from
If-
outside. Just rinse yourself off. You don't have to go do a big, just rinse, take those clothes off and rinse yourself off. It's important.
You'd be surprised if you sit and watch some people how often they touch your eyes and their mouths.
I do that a lot. Actually,
Yeah.
I'm sorry. I do that
Yeah.
a lot. I don't know if it's a habit or what it is, but I realize I
Yeah,
checked
a
it.
lot of people do it. So you're touching a doorknob and you're really not cognizant of, you touch a doorknob and, you go about your business. But you touch a doorknob and then you're going to scratch your eyes. Somebody before that might have scratched or picked their nose or whatever, and that same doorknob. So, that's how things get
transmitted.
Yes, and get icky and have a happy party. And you end up getting it.
Okay.
Yeah.
I just
So
got
it's
grossed
so
out.
important. Yeah, it's so important to wash your hands. And they're also talking, if that's 6 feet, the distance is 6 feet. It's important also.
And I do think this is a great lesson for us too, moving forward. I know, I get a lot of things. I get lessons from everything. I think this is a great lesson for me moving forward to understand that, you know what? Regardless whether COVID is still going on now or not, my rules in the salon is still the same. You come inside, you sanitize. We may eventually get rid of taking the temperature, but you will be sanitizing. And we are going to still, sign in when you come in. Because those are ways that most salons, I think we should always keep that for contact tracing or whatever the reasons may be. It may not be COVID-19, but something else that we could call that client, because that's what happened with me. When I had COVID, I went through, and I think there was about 28 people that came through these doors that within the last 3 days that I worked here. And I ended up calling all 28, and they were able to get tested, which was great for me. At least I know, what, thanks be to the Lord, I didn't get anyone sick, so everybody was tested and was fine, thank God. But I think for me, some of my lessons will be to keep a lot of the things that we are doing now should stay. Wash your hands always. Sanitize always. Cleanliness always. With that being said, I have a quick question, or maybe just a statement I'll have for you. A quick question. For a community like ours we live in, what would be what advice would you give to what would you like our community to know? Because we live in a community that is very afraid of taking a vaccine. We have issues, we have questions, and I wanted to do this interview because our community are not educated on it. And we live in fears, and we hear this and this is happening and that's happening, so I don't want to take it because they may, they and them and these and them and YouTube, and everybody has an opinion. So from a professional standpoint, what would you say to our community that could probably encourage us to probably stay safe or get vaccinated, or what would be your...
Educate yourself and ask questions. I've always said to my patients to come with your questions. Write them down. Ask as many questions as you need. I'm not on a time... my clock is not ticking when my patients sit in the chair.
You're not doing a 15-minute thing, Doc?
I'm not. I actually don't. Okay. And the reason why I don't do that is because I put myself in their shoes.
Right.
So I know how... This is a hot button topic, which is health disparity. It's huge in the Black community, and it's very apparent. And as someone on the other side, I see it. Yeah. And I experience it, and then it kind of flips a little bit once they realize that, yes, I'm in the healthcare field, and everything kind of gets turned upside down, and then the red carpet is rolled out, and you get everything that you want,
Wow.
which is unfortunate. But what I've actually said, some things that might help with that, and it's not always, it not always happens, is maybe find someone that looks like you. We're few and far between, unfortunately.
Yeah.
Not everyone, and I don't want to stereotype or say anything,
And you're
but
not. We're just being honest.
yeah, I mean, there are a
Be
lot of my
comfortable with your
patients.
doctor or whoever you're going to.
There are times that you want to, because you're able to relate. That person is able to relate to you. You feel more comfortable with saying certain things,
Got it.
and because they have lived what you have lived, and
Like,
that
I like
actually
a female
helps.
gynecologist.
Yes.
I like a female.
Right.
There's things about my body
Right.
that I feel like they could relate to. My
Yes.
sister like a male.
Yes,
So, things like that. She could relate better to a male, and I would relate better to a female gynecologist. So I do get that.
right.
Um,
If you feel that you're not getting the care that you need to find someone else. Do not remain stagnant and feel that I need to see this person because the insurance company is dictating that I see Dr. Smith.
That's another thing. A client was saying that they're being charged for the vaccination, and they're being charged, for not only for the vaccination but to be tested. I thought I was never charged. I didn't know that.
I do hear facilities that are charging for the visit and not the vaccine,
Okay, so it's
or
like,
they're charging for the vaccine and the visit, or they're charging for the vaccine and not the it's like it varies, but I've heard that a lot too.
Yeah.
That people are being, and for testing, and for
Yeah.
testing also.
because when I was going to get my vaccination, I had a couple of appointments,
Mm-hmm.
and one did call to say that there's a charge. I think it was $150 charge to be
Wow.
vaccinated.
Wow.
And I said to them, "Thank you, have a great day." And I did get my vaccination. No one asked me for a charge. I filled out, and, which was great. But I say to my clients, and I say to people that watch this podcast, and I agree with you, and I think I share this sentiment. Educate yourself. Be your own advocate for your health. Be your own advocate. Whatever your decision is going to be, think about the people around you. If you have older parents, and another thing, if you choose not to be vaccinated, just know there are some rules you're going to have to follow. Follow those rules, because you got to think about the people that's around you. I work in a salon, and there's no way I could not be vaccinated working in the salon. I'm standing over a person's head. So as much as I've never had the flu shot, because I was one, and I'm going to be honest and be, forthright. I never believed in taking the flu shot. I didn't want the flu shot. I hope people get sick, so I never took the flu shot. But from a person that have had COVID-19, from a person that had family members and close friends dying from COVID-19 and seeing the effect of it, I had to be proactive. And I didn't want to be the one to be transmitting it to a client, God forbid, or a family member. And I had friends that I do hang with, and they're like, we all are vaccinated. It's like 4 of us or 6 of us, but we all are vaccinated. And even though we're vaccinated, like we wear a mask, and we still, in distance, like we're here now and everybody in this room is vaccinated. But, I love that you still have your mask on because of what you're doing. I respect that. And I still do that sometimes. So I'm not great at it. But I'm working on still keeping that mask on.
Well, the reason that I do it is because I'm around people all the time.
Yeah.
And this virus, oftentimes people are asymptomatic. And because I'm around people all the time, I don't know if this gentleman that's sitting across from me is immunocompromised in any way. Not because he didn't say anything, that doesn't mean that he's not. And what if I have it and I give it to him? Then,
Right.
we have to also think about people who have children who are not eligible, who are young, under the age of 12, who are not eligible to get this vaccine. So, okay, we're exposing ourselves and we might be positive. You bring it home to your child. That's not going to be good, because as a lot of people often know, children don't respond the way adults do when they're sick. And when they're sick, they go like that. They tank very quickly.
Very quickly.
Yes.
But I will say this though. I know you've had sleepless nights, you've vaccinated a few, you've what. I want to personally take the opportunity to say thank you for your service. Thank you for being one of those people that's been there for us here in New York. It's been rough, I know, for you. You have family. You've been away from your family.
Yeah.
So I truly, truly, truly want to say I appreciate that.
Yeah.
People take it for granted sometimes that the people are out there that are caring for us. You know, they're caring. Who's taking care of the caregiver, I like to say. So, you know, of course, I have some goodies for you today before you leave. But I want to make sure, before we wrap up, too, to say thank you. But before we go on another positive note, you know, this is EOB Salon Talk, right? So we're going to have some little fun, you know, just to lighten it up a little bit.
All right.
This is heavy. I know it's a little bit heavy, and I don't want to dive into... So I'm going to break it up a little bit. So I'm going to ask you a hair question, even though you're a female.
Okay.
What are some of the experience you've had in salons that you've been through, good or bad? Just give me an example of some funnies that happened in the salon.
Worst time in the hair salon is the wait time.
The wait time. So guess what? You could appreciate COVID now because the wait time is less.
I'm a stickler for time.
Well, yes, I know.
If I say 6 o'clock, I'm here before 6 o'clock. That's just me. And I'm a planner, so I have everything planned out. So I'll say, okay, I'm going to be in the hair salon from 6 to like 10. If 10 o'clock comes, I'm itching and I'm going. And I'm one that pay for service, and I pay very well. So if I expect you to do something in a 4-hour window, I need you to do it in a 4-hour window. Because this is what you charge. I make sure to pay you for your service. I don't skimp on it or whatever. You're professional. You're providing the service. That's what I want, and I'm out. That's
I love this question because
that's just me.
This is one thing COVID has done, especially for me. Like, my schedule gets real crazy, and what I find now, I get to have that personal conversation with my clients. I get to have that one-on-one. I get to speak to my client. It's just us, and you're in and you're out. And I remember I finished a client one last week, and she said, "We're done?" I said, "Yeah, and I'm sorry I'm not rushing you out, but we have to just bid farewell and welcome the other person in, you know, because it takes us a little while. We have to clean up afterwards. So it's a little work for us too as stylists, because once that client leaves, we got to clean up and wipe down. As you get up, we get wiped down and sanitize, because I can't put another client in this chair unless we sanitize it. So, you know, I need that little break, that little window in between the clients. So I actually appreciate that, and I think I'm going to keep that.
I do have to say, though, even though I'm a stickler for time, I like to always be in constant communication. So things happen. You can't control everything. If there's anything if you're running late or whatever, but call me. That's all I need you to do. So I know you haven't been to me yet, so I'm going to ask this question. So what's the longest time you've spent in the salon? Oh, wow. Maybe about 8 hours.
Did you get paid? I just mean, did you get paid, Jeff?
No.
No, 8 hours, really?
8 hours.
Extensions?
And it was in Brooklyn.
Natural hair?
It was extensions that shouldn't have to take that long. Yeah.
Okay. 8 hours was the longest.
It was a long time.
8 hours.
I was exhausted.
8 hours in a salon. 8 hours. I'm a stylist, but I have nothing to say about that.
Yeah.
8 hours. That was a long time. Because for me, but even for the stylist, for me, I feel like if I have you there for 8 hours, I could have done multiple clients. You're not paying me an hourly rate. So I kind of not want you there for 8 hours. I like you and everything, but I would not want you.
Yeah, no, I appreciate it. And, you know.
I'm so sorry.
I agree. I agree.
It's an extension. It's a 2.5 hour for me. If you're getting a treatment, it may be a little bit longer because I like to treat my clients before I do any form of installs and make sure the hair is ready to, you know. So sometimes it may be a little longer. You may be getting a steam treatment, but
It was long.
That's a quick question
painful.
too. I want to ask this because I'm in the salon and I'm working on with COVID. So I do use the dryers and stuff. And before, in some states, there were conversations about not putting people under the dryer because it will spread the COVID. I just want to talk about some of the myths we have, and what's your
I didn't hear that one about the dryer, but yeah, there are a lot of myths that the metal in the vaccine that alter your DNA and all these things.
Right.
But no, it's transmitted via droplets. So if you're singing, it's airborne. So you're singing, talking, or anything like that, those droplets come out and it's going to land wherever. So whether it's under hair dryer or just sitting here, the hair dryer is not going to, it's no different than me sitting here and speaking to you without a mask on. Those droplets are going to come
I have
out.
a client, she would not use the steamer because she said that the steamer is going to pull the COVID out. It was.
But she's in an enclosed area, so does it matter?
I didn't fight. I just didn't give her.
No, I understand, but it's like sometimes and then sometimes you're gonna just keep answering questions, and you'll never make someone happy. You'll never answer the question. You never give them the answer that they want to hear, and then you'll just have to just direct them that maybe you want to check this website out, the CDC out, or World Health Organization or something like that.
So now that you say that, so what's a website that people with concerns and questions and just issues, what's like a good website they could go on?
So they could go to the CDC, they could go to New York State Health Department website, they could go to New York City Health Department website. It has a lot of information.
And there's still a lot of vaccination sites around, and I think they could find those on the website.
There's still a lot of vaccination sites around. You can get free vaccines you don't have to provide an insurance card or a copay or anything like that. At our health department, Westchester County Department of Health, we have a Yonkers location, we have the White Plains location, and we also have pop-up sites. Even though we have pop-up sites, you can't, if you see a pop-up site somewhere and you come in and you want to be vaccinated, we're not going to say, well, you don't belong to the salon, you're not allowed to get vaccinated. We'll never do that.
Okay, because I did have a couple of people walk up on my pop-up site. One person was from the city and another person was from upstate. And it was weird. And I said, but you're coming back here for the second dose. And she said, yeah, that's fine. I'm in the area. So. And
then some people go elsewhere to get the second dose.
Oh, that was another question. So they can go elsewhere to get the second dose.
Let me see how I'm going to answer this question. And it's because I'm on the other side. So it just makes it a lot more difficult. Okay. So you go to Walgreens and get your first dose vaccine in Queens. And then you go to the health department in Westchester County and get the second dose. So you got it 2 different places, right? There's sometimes that Walgreens might not have put that information into the system. The state and the city are 2 different entities, even though they're under New York State. I can't go into New York City's system. New York City can't come into my system, even though I have access to both. So yes, I can, but not somebody can't just go in and say, let me look into New York State system from the city's point perspective. You can't get that information. Oftentimes what we've been encountering is that people have lost their cards. They lost the card, they didn't take a picture of it and got vaccinated somewhere in Queens. And then they got vaccinated somewhere upstate. And guess what we have to do? We have to play Inspector Gadget and get that information. It takes a long time to get it because you have to send correspondence to the state. Sometimes we've had places where they got vaccinated that no longer is in operation at all, and they have no information. We do eventually find it somewhere, but it takes up a lot of time, to be honest with you.
Wow.
So if you can go back to the same site that you got vaccinated, I would go back to the same site and take a picture of the vaccine card. It is so helpful.
So what I did with all the people that came to my site this week was I had them, as soon as we gave the card, to take a picture of it. And one lady took 2 pictures, and so she sent one to her mom and one to her sister. And I said, that was so cute.
Yeah.
I said, why you did that? She said, I always lose my phone. So if I lose my phone, my mom has it, which was such a great idea. And she actually taught me something, because I actually forwarded mine too. So I put mine in my cloud. These phones, they have,
Yeah, I know, it's fancy phones and stuff.
So I actually did do that. But I also have the Excelsior app.
The Excelsior Pass.
So we encourage them to get it, but it's not, I think one thing the gentleman that was here stated that it would not be in yet.
Until 14 days.
Until 14 days.
So it takes up to 14 days for you to get after your second dose.
Okay, so 14 days after your second vaccination, you could go and put it in the in the app.
But I have to be very, very, very
precise.
Whatever you put on that registration, that screening form that you fill your name out, is the exact information that you have to put in Excelsior. So if you put Jane A. Smith on that sheet when you're filling it out, that screening questionnaire, that's how the information is going to be entered into the system. So you're not going to get Jane Smith and the information comes up. It's not. You have to put Jane A. Smith. It has to be spelled correctly.
Okay. Yeah.
So I always tell my patients that what's on your driver's license, put the same thing on this card. Put the same thing on that screening sheet. It's almost like when you're purchasing a plane ticket and they say the name on the passport has to correspond with the name on the ticket. It's the same thing because it's a medical record. Once it goes into that, now it's a part of your medical record. It's a part of that vaccine immunization record. I can't tell you how many people cannot get their Excelsior Pass because they didn't put both their last names, or the E
number
looks like an O, or the phone number, or they forgot the date. So the date is different. It's a nightmare because then what I have to do oftentimes is to go in and have to change the record. So I have to change the whole name around. That's time consuming.
Yeah.
Because not everyone is able to do that.
Wow. So I experienced that too when we were trying to help an elderly lady out, putting hers on the pass, one of our volunteer, and it took the gentleman to figure out that. So we said, when they call you to remind you about the vaccine, where did they call you? She said, oh, they called at my house. We realized she used the wrong phone number. So yes, I've experienced that also.
Yeah.
Did I miss any questions? Let's see. I don't think I missed any question. And I think we did a great job, I think. You did a great job, I must say, with answering any question. But is there any blanket statement, any other questions that you have gotten that you probably want to clear up here regarding the vaccination? And then I'll ask you some fun questions.
I just want, for me, I just want everyone to take it seriously. I'm not the one, as I said before, to mandate or force someone to take the vaccine, but take the initiative of protecting those around you, whether it's getting the vaccine or masking. It's just a mere inconvenience to put the mask on if you're going into a store or, you're around someone that you're unsure of their vaccination status. And then when you get in your car or your house, you're free to do whatever you want to do. But really just consider everyone else. That's what I do. I'm around my colleagues every day. I don't know what their lives are like when they leave out of there and they have to go home. I really have to consider everyone around me. I have parents. I had a grandfather that passed away last year from COVID, and he was in a senior center. And we have absolutely no idea where he got it from. I felt guilty at one point because I thought it was me because I was testing people like you would not believe, and almost everyone I tested was positive, but I was never around him. That's how I know I didn't give it to him because I wasn't around him. But then you feel all that guilt, and he was in a hospital, passed away on his own because we weren't able to go and see him. We weren't able to be with him. So a lot of people experience that where they only saw their loved ones on Skype or over the phone with you hearing the doctor telling you, well, you know what, we're going to take him off a vent, or there's nothing that we can no longer do. So, when you've been affected in that way, when you're in 100-degree weather in PPE, testing people, and you're dying and sweltering, and by the grace of God, you come out and you're fine and you never got it, I have to tell you that's something that, that's positive that come out of it. And, I'm a firm believer in vaccines, but also I always want, myself and everyone just to educate yourself and ask questions. Questions were made to be asked. There's no stupid question. You wouldn't ask a question if you had the answer.
That's true. That's true. So, EOB Salon Talk, here at EOB Salon Talk, we like to ask you this question. What's one of your favorite quotes or sayings or?
Each one, teach one.
Each one, teach one. I like that one.
Yeah.
I actually like that one. Each one, teach one.
I use it almost every day. Why, you have that knowledge. Why are you hiding it? Why are you not passing on that information?
Well, Dr. Nicole, thank you so much.
You're welcome.
For being here.
You're welcome.
Thank you for being, just willing to be a part of this, just to speak to our community, actually. And just, I hope we've answered a lot of questions. And if there are any other questions, please put it in the DM. Please put it in our box, in our DMs or YouTube. Send questions in and ask the questions. We are definitely willing to send. And then also, don't forget to go to the DM I have my NutriBurst. You could get free samples. Just DM me and you'll get free samples. I'm gonna make sure you have your package here, Doc.
Oh my
this
God.
is yours.
Thank you.
Because I do appreciate what you're doing.
Thank you very much.
CMOS and
Thank
NutriBurst
you
for you. So thank you once again for being
I appreciate
here.
it. And thanks for having me.